A new study finds the opioid epidemic has put a heavy burden on hospitals across the country.
Researchers say there's been a sharp increase in admissions, deaths, and cost. Seth Lemon takes a look at the numbers.
29-year-old Robert Goldstein was an Indiana father of 4 who died of a drug overdose this week. His siblings say he struggled with his addiction for 15 years.
It's torn us all apart.
You wanted to shake him and tell him, like, you have to stop.
A new study by Boston researchers found between 2009 and 2015, ICU admissions for opioid overdoses at 162 hospitals increased 34%. Dr. Timothy Brennan is an addiction specialist.
The sickest patients in the hospital end up in the ICU. So when we think about the opioid crisis, tragically, we're talking about a disease that is killing people or putting them right up to death's door.
The effort to save these patients rose sharply over the 7-year study. The average cost to treat an ICU patient in 2009 was just over $58,000. In 2015, it was just over $92,000, an increase of 58%. Researchers say despite the care provided in ICUs around the country, the opioid epidemic has left people sicker. The study shows that hospital deaths from overdoses have doubled.
How many people have to die, or how many families have to be devastated by this disease? Like, an addict's almost considered a criminal right off the bat, and I don't think that hasn't worked for treating this so far.
Goldstein's family hopes sharing their brother's story can change attitudes toward drug addiction and save lives. Seth Lemon for CBS News, New York.
Just yesterday, President Trump said he plans to officially declare the opioid crisis a national emergency and pledged to ramp up government efforts to fight back against the epidemic.